Welcome back. A new year means a new chance to get off to a healthy start, and Secours is trying to make sure that you can do that easier than ever by increasing access and making sure healthcare is more convenient. Here to tell us more about this at Secours Chief Clinical Officer is Dr. Bruce Swords. Thank you so much for being here with us. We appreciate it.
Great to be here. Good morning.
Yeah, so we were talking a little bit about how obviously you guys' goal is to keep people out of the hospital, but if they have to go to the hospital, you're going to make sure you have convenient access points. So talk a little bit about how you guys have increased your community access for folks here living in the upstate.
Sure, happy to do so. We've got 2 acute care hospitals and a freestanding emergency department, and from that point of view, we would like to encourage people when they need to, when they have a real emergency, make it to the hospitals. Yeah. We do have a slew of other access points throughout the communities in addition to the hospitals.
Now, we're not talking bookmobile medical care. We're talking about standing urgent care buildings, facilities that have been built around the community, is what you say.
We have bricks and mortar offices
no motorized
everywhere.
Medical care.
We have that too.
Ambulance.
We've got that too.
Yeah.
But we have lots of access facilities in our outpatient ambulatory facilities, some that have been part of the community for generations and some that are brand new.
We're looking at some video of some of those campuses that you have, physical campuses, and of course, like you said, you have those mobile units that go into the community as well. Why is that so important for you guys to have so many access points, so many campuses, so many facilities, so our folks can stay close to home and have that convenience of being around their family and their friends and their support systems as well?
That's right. I think you answered the question for me, but we're looking at, I think that's the previous one was our Simpsonville Emergency Department site, in addition to that being a full-fledged emergency room. So ambulances will go there, you can go there with any emergency and we'll take care of you. And in addition to that, we have multidisciplinary outpatient clinics there as well. What we're looking now is we have a wide range of urgent care facilities throughout our communities. So for patients who are seeking something now, I want care now, but it really doesn't fit the definition of an emergency. I think we now have 18 urgent care facilities that are open to the public, and happy to see in those sites as well.
And what communities are they in?
Yeah, so they really go from
a lot of places, 18 places.
Clemson to Simpsonville.
Yeah.
We have them locally right around the corner here. So they are throughout our communities, widespread, and I hate to have everybody go to a website, but bonsecours.com, urgent care, you'd be able to see all of them.
Well, you have such a big impact, you need that.
I was being a bit facetious when I mentioned mobile, bookmobile, but you alluded to the fact that you have units that go out and provide things other than mammograms or whatever?
Well, in addition to mammograms, so we'll have our second mobile mammography unit here shortly. I can't remember the exact time frame, and we do have a mobile clinic that will go from site to site. Especially trying to seek people who maybe are typically underserved. So trying to keep those people's care at the forefront of our mission and making sure that we're caring for them as well as people who have easy access to our other sites.
And we appreciate you guys for closing that gap when it comes to access to healthcare, because we know a lot of times in the rural communities, a lot of those folks don't have access to it. So those medical issues they have tend to compound and add, they don't get the treatment they deserve.
That's right. We, in our communities, like just about every other community in the United States, there are healthcare deserts where people are typically underserved and in need, and we'd really like to be able to provide care to those folks when they need it.
And you're continuously increasing the access too, so you guys are adding even more facilities, even more opportunities for folks to receive the care they need.
We are. We have a growth plan. Maybe at some point everybody won't need health care, but for the time being, people need access to health care, and we plan on meeting them where they are and in the communities they live in.
Right. Well, you're growing, and maybe screenings are in the future too at some point.
We have all sorts of opportunities for screening. Mammograms might be one of them.
Yeah.
And so we have other sites, and we can do screening at our bricks and mortar sites as well.
Coming up on Heart Month, that's a good time to get your heart screened as well. So Dr. Swords, thank you so much for all that you guys do at Secours. We appreciate it.
Thanks for having me.
Yes.
Appreciate it.